I think about how Manchester has, moved forward in this pandemic. It's been, I think, in a nimble way, certainly with the underlying tone of safety, from moving from in the classroom to distance learning, maybe back. Also within the building, making sure that everybody was safe by having distance that was appropriate and masks. I think my colleagues, I think the administration, everybody's been nimble, and the students especially have been nimble, right? They've been thrown into this, at a time when they've really are deep into their academic careers, and boy, it's a lot to take on, but they've been doing it because we've had the same mindset. It's been positive. I also think that in the community, the reaching out to connect people. We've done that from pharmacogenomics, and it's being done in pharmacy too. So, really very proud of what Manchester's done.
We have created a team to be able to test students on campus. A lot of the student athletes were required to get tested before they had a game or they were involved in practice. Coordinating all of the students to make sure that they get to the sites and testing has been a big effort from all of the different departments coming together into one.
Every Monday I come here to help with the COVID test. It's a nasal swab and it takes around like 15 seconds. My role here is to verify the student information because we want to make sure that the right result goes to the right student. The benefit of doing this is to prevent the spread of this infection. We know how it spread really fast and really quick. So the more tests we perform, the better chance we have of catching someone with a positive result.
The College of Pharmacy has done some research in terms of inflammation and understanding diseases. Doing the vaccination programs. A lot of the testing techniques that are currently being used are actually being used in our own laboratories. We have genetic testing, we have the new technology that enables us to detect COVID-19.
I think we'll continue to see a lot more focus on genomics and personalized medicine, and I think the pandemic has continued to push that forward. The Manchester education really has prepared me well for what's happening with the pandemic, and I think the liberal arts background at Manchester has really been important and essential in my role now as Chief Medical Officer. It allows me to really critically look at situations, communicate well, determine what's noise and what's actual data, and how do I move forward in a way that best meets the needs, best works financially, and best supports our providers, and most importantly, allows us to provide the best care to our patients every day.
I think healthcare has probably forever changed in the way that we use telemedicine. It could be something that's going to be widely used, and I saw that many years ago, and I've now expanded telemedicine to a full half day in my office. I enjoy it. I enjoy not working in a mask for a period of time, and I think patients enjoy that as well. So that is one good thing that's happened. Manchester prepared me well beyond just the sciences.
Manchester has been responding proactively, even in protecting our students. They were proactive in this pandemic and trying to go to online learning and notifying us. From our P1 year, Manchester trained us in the APHA certification to be immunizers. So from our P1 year, we're set and ready to go out and help the community in any way possible. I've been over at Parkview Clinic at least, 15 times now. It actually started during our finals week. So our student volunteers, they immediately filled up all of the slots. Even during finals week, we wanted to get out there and help our community. So we started signing up for dose prep as floaters and even immunizers in any way we could help them out. You get a lot more satisfaction out of actually just servicing the community and being out there. Before, that was pretty much all I did, work, take care of my kids, and now I realize there's more out there, and this pharmacy program has given us the opportunity to really make an impact on something we never thought would happen in our lifetime.
Even though sometimes we feel like we're at two separate campuses, we're always not sure of how we are united, but when we come in a situation such as in COVID-19, we can bring all of our talents together into trying to accomplish a goal, which is reduce the spread of the disease. that would affect the rest of the community, not just North Manchester, but just going forward. We as a community in general are ready to just respond to whatever shift that we need to respond to for COVID.
One thing that's really impressive in my view is how Manchester has kept its mission in front of it. Manchester has not swayed or deviated from their mission to get Manchester people out there to better society. Even in this time of this pandemic, Manchester has worked to meet its mission, to fulfill its mission, and I'm really proud to be with Manchester.